Good morning and welcome back to the final day of the 2020 Us Against Alzheimer's National Alzheimer's Summit. I'm Russ Paulson, Chief Operating Officer of Us Against Alzheimer's, and this morning we're going to hear from two of our nation's leading voices on caregiving and public health, both of whom have new books. Dr. David Satcher is the 16th U.S. Surgeon General, former Director of the CDC, current board member of Us Against Alzheimer's, and Dr. Satcher has just written My Quest for Health Equity, Notes on Learning While Leading. Also Diane Rehm, a nationally recognized NPR host, author of When My Time Comes, conversations about whether those who are dying should have the right to determine when life should end. Dr. Satcher and Ms. Rehm will share lessons learned from a lifetime of public advocacy around respecting the dignity of patients, individuals, and caregivers as people age. Yvonne Laddie, an award-winning journalist and caregiver, will moderate this discussion. Yvonne?
Hi, I'm Yvonne Laddie. I am a journalism professor at NYU and the graduate director of a multimedia program. But I think I'm here mostly because I'm the daughter of someone who is suffering from end-stage Alzheimer's. I'm a caregiver. And honestly, my mother's a Dominican immigrant. So it's been really rough. And I'm really honored to be able to be a part of this conversation with two really amazing people with so much to offer on all of this. Because the more we talk about end of life, the more we face it, the more we understand it, the easier, peaceful, and more celebratory that journey can be. I mean, one of the things I have experienced a lot in my mother's journey is just so much sadness and pain and anger and confusion. But when I think about the end of life, especially after reading Diane's book, I think it deserves to be so much more. So let me introduce the two people that are going to be speaking with me today. We have David Satcher. He is the 16th U.S. Surgeon General. He is a physician scientist and public health administrator with an extensive track record of leadership, research, and community engagement. Dr. Satcher served as the 16th Surgeon General of the United States from 1998 to 2002, and the 10th Assistant Secretary for Health in the Department of Health and Human Services, and that was from 1998 to 2001. He also served as Director of the Centers for Disease Control and Prevention and an administrator of the Agency for Toxic Substances and Disease Registry. And then we have Diane Rehm, who is an NPR host of On My Mind podcast, but I think a lot of us have heard her on the radio and in her own shows. She's had an incredible radio career that has spanned more than 40 years. The Diane Rehm Show featured on WAMU and NPR grew from a local program to one with international reach and a weekly audience of more than 2.8 million. Diane now hosts On My Mind, a podcast featuring conversations on the issues she cares about most: what's going on in Washington, ideas that inform, and the latest on living well as we live longer. Diane is the author of 4 best-selling autobiographical books and is a director emerita of the Penn-Faulkner Foundation and a trustee emerita of McDonald College. She was married to her beloved late husband, John Rehm, for 54 years. In 2017, she married John Hagerdon, a retired Lutheran minister. She has 2 children and 4 grandchildren. And thank you both for being here. Every time I read bios, I worry that I'm going to hack them, because mine has been hacked so much when they've been read. But hopefully I did okay. And I just got to say, I'm so happy to be here with you both and get to talk to you about this.
Thank
I guess My first question actually is for you, Diane, because I am clearly a Black woman. My mother is Latina, so am I, and in your book, which talks a lot about, which really is about dying with dignity and dying with assistance, it's really clear to me that to do that costs money. And a lot of the people in my community don't have that kind of money to spend thousands of dollars on drugs to end their life. There's also a fear in communities of color. When you look at the amount of African Americans and Latinos who are involved in even things like clinical trials, the numbers are low because historically, especially when you look at the African American community, our bodies were used for experimentation. And so it seems like there was a disconnect to me. Like it felt like if you are wealthy and white, this is an incredible option. But if you're poor or working class and Black or Latino, you're just going to die. And especially in the Alzheimer's community, where could someone like my mother consent now? I mean, she doesn't even speak. How would you address that?
Well, let me address your three questions, really three. First, on money. A long time ago, the medication required to end one's life when Oregon, the first state to adopt medical aid in dying, came into being. The medication was very inexpensive. And then, as you may or may not know, that drug was taken from a cost of some $10, $20 to thousands of dollars. And then that pharmaceutical company sold it, and then it went off the market. We are now back to a reasonable cost for the medications that are used in medical aid in dying. Secondly, you're absolutely right about the mistrust on the part of people of color. I spoke for both the documentary film, which is coming out next spring, on which my book is based. I spoke with a pastor of an AME church here in Washington who said precisely what you've said. Why should anyone in the Black community trust the medical profession to do right by them because of experiments that go so far back to Tuskegee and the like, to making people feel as though they are less than human? He finally said, if you, Diane, could guarantee me that Black people would have as fair treatment as white people in their medical treatment throughout this country, then I would support you in medical aid in dying. Finally, in regard to Alzheimer's disease, I am so sorry about your mother. I must tell you that the laws regarding medical aid in dying in this country at this time do not include Alzheimer's disease because all of the lawmakers who passed these laws have felt that that goes one step too far. So I have taken matters into my own hands and have videotaped with my grandson a message to my family saying that should I begin to exhibit signs of Alzheimer's, I do not wish to go on, and I will end my own life. If the laws have not changed by the time I've reached that point, I will do as my husband did, my late husband. I will stop eating. I will stop drinking. I will stop taking medication because I do not wish to live through the suffering that your mother and your family are now experiencing.
Thank you. Dr. Satcher, your book is about leadership and the lessons you've learned throughout your life, from milking cows in rural Alabama to being our nation's 16th U.S. Surgeon General. What does leadership look like to you in the fight against Alzheimer's?
Well, I should say at the outset that my wife died in June of 2018, and she had suffered with Alzheimer's for more than 10 years. Her mother, before her, died in 2003 of Alzheimer's. So I've had this personal experience with Alzheimer's and the suffering that goes along with it. In my own life, of course, even though I've had those experiences with very close relationships, I haven't worked out any plan for myself, and I don't know to what extent Alzheimer's will be a factor in at the end of life for me. But I've had quite a life. I'm almost 80 years old and had a chance to practice medicine and do meaningful research. I've been president of 3 institutions, Meharry Medical College, Morehouse School of Medicine, and Charles Drew. I was actually CEO of Charles Drew before it became a university. And so I think what leadership has meant to me, because I have become leaders at times when there was a crisis or a significant need for somebody to step in and provide leadership. It was not because I sought leadership positions. In fact, in most cases, just as at Morehouse School of Medicine, my plan was to lead a department of family medicine. And then when I got there, the Meharry situation came up, which some of you probably remember, in the early 80s. And they were saying that Meharry was going to close. I'm not a Meharry graduate, but I was encouraged to at least go for the interview. And when I did, decided that it was the kind of thing that was too important for me to say no to. That's been the nature of leadership for me. I was on the way to somewhere and ended up going another way because of the needs and the importance of an institution. In Meharry's case, it's amazing that so many of its graduates had gone to practice in underserved rural or inner city communities and provided care to people who needed it most. The institution had taken care of poor people, many of whom could not pay for their care. And so it's been that kind of experience where I have not sought leadership roles. in most cases wanted to do something else and go somewhere else, but decided that it, it was important that I change my plans. So that's been the nature of leadership for me. There's a background, of course, I talk about in the book that started here when I was a student 60 years ago. The student movement here in the Atlanta University Center was started by people like Marion Wright, now Marion Wright Elman, but also in situations like the student sit-in movement, where the issue was, the right to eat at a restaurant, or the right of somebody to refuse you because you were Black. And so I ended up going to jail with other students here on 5 occasions. And I think that helped to shape me in terms of how I feel, what I believe. And I feel good about the fact that we were able to participate in changing not only Atlanta, but the South. And so that's been the nature of my leadership development.
Diane, your book has a lot of powerful stories and interviews with terminally ill patients, their caregivers. It's very, very moving. But what did you learn from these conversations?
Well, I learned that there are good reasons for people to have very different beliefs. I learned from speaking with a Roman Catholic priest how deeply felt his beliefs are, coming directly from the Bible. I learned from a physician in Oregon how strongly he disagrees with medical aid in dying, because he believes that the doctor's role is to go on the journey with the individual who is dying and to be with that person the whole time. However, I learned from a 37-year-old mother with breast cancer that had metastasized throughout her entire body. She said, "I'm dying. I know I'm dying. If I had my druthers, I would live to be 90. I don't have a choice. I am going to die. I do not want my 13-year-old son to see me in agony. I do not want him to see me suffer. So I am glad that I have control, a certain amount of control over the end of my life." And that is the one thing that every single one of these patients spoke of, having some measure of control at the end of life made them feel more calm, made them feel easier about dying, knowing that they could bring their own suffering to an end when they chose. The other question that was posed to me again and again, and may be in the minds of some of your viewers and listeners today: what is the difference between medical aid in dying and suicide? Why do we not refer to this as medical aid in suicide? because people who are dying have no choice. One who commits suicide has a choice to live or to die. Those who are dying have no choice. They know they will die. We worked on this film and I on the book, Yvonne, for 3 years. So I've learned a lot during that time, and I'm so thankful I have.
Before we go on, I just want to make sure that people know the names of your books, because they are really profound and life-changing for anyone who's lucky enough to read them. Dr. Satcher's book is called My Quest for Health Equity, Notes on Learning While Leading, and Diane's book is When My Time Comes, Conversations about whether those who are dying should have the right to determine when life should end. Dr. Satcher, what are your thoughts on medical aid in dying?
That's what you call throwing a curveball. I couldn't hit them very well when I was playing sports. But first, I think it's a very important topic. I can't think of a topic that's more important than that. And even though I spoke about my wife's death, because with Alzheimer's, people die differently. My wife was diagnosed with Alzheimer's 20 years before she died, in great part because her mother had suffered from Alzheimer's and had died from it. And so I must confess, never really dealt with the issue of dying the way Diane is discussing it. I know how important it is, but it was not something that we actually dealt with. My wife never expressed a desire to end her life. That doesn't mean that she didn't think about it. But obviously, I think I would probably deal differently with it in my own case, and if I have another experience with a very close personal relationship with one dying over a long period of time. My wife was very active up until about a year or two before she passed, and even though her level of activity and productivity changed over the years.
Yvonne and Dr. Satcher, I should be clear about what medical aid in dying is. Medical aid in dying, as written in Oregon and has been copied by 9 states plus the District of Columbia, permits medical aid in dying if 2 physicians have verified that a patient is within 6 months of death. Alzheimer's does not fall into that category, as clearly you have mentioned regarding the life of your wife. All kinds of safeguards are in place. In some states, a psychiatric evaluation is required to ensure that that individual is not being pressured by anyone in the family, and that psychiatric evaluation is done just one-on-one with no one else in the room. And I must say, doctors take this very seriously. Those who have agreed to become part of the medical aid in dying movement regard it as a calling, something that they are willing to do to help ease the suffering of a dying patient. But Oregon has now said that there will not be a 2-week waiting period between when those two doctors have certified that this patient is within 6 months of death and when that medication can be provided. Because in some cases, patients were dying within that 2-week waiting period. So Oregon has now done away with that. But I just want you to be sure to understand that right now, Alzheimer's disease is not an issue upon which doctors can make a decision to allow medical aid in dying. I, for one, hope that someday it will be included because the suffering of patients and their families over many, many years can be, I've seen it myself, and it can be just horrific. So I just wanted to jump in with those thoughts.
Well, that's really helpful to hear.
So,
It's really complicated for me because I feel like if my mother was in her right mind, she would not want to live like this because she is no longer herself at all. I mean, she's completely unrecognizable. And all the things that made her who she was, Alzheimer's has taken away. And so, as a daughter of an Alzheimer's patient, even though my chances of getting the disease are low, it is still slightly higher than the rest of the population. And it makes me think, like, would I want to put my daughters through what I've had to go through? When what I've gone through is something I wouldn't wish on my worst enemy. In many ways, my mother doesn't know what's going on, but I see it all and I experience it all.
Yes.
And the dignity of the death is lost in Alzheimer's. So, but it's complicated because the person, you would have to do it immediately at diagnosis, and then everyone's journey in the disease is so different.
Well, not necessarily immediately at diagnosis, but that is why I taped that message with my grandson. And while he was taping me on his iPhone, the videographer for our film was taping the two of us as we had that conversation. And I did so because I want my family, I want my friends. I've already spoken with my doctor. I want them all to know that should I receive that diagnosis and should it begin to progress, I need their feedback as well as my own feelings. I, like my husband, who ultimately died of Parkinson's disease because he had lost all sense of dignity, decided to stop eating, to stop drinking, to stop taking medication. It took him 10 long days to die. He was of totally sound mind, but he was in a nursing home in Maryland, which did not then and does not now allow medical aid in dying, which was what John Ream so much wanted for himself. So the goal of this documentary and this book is to begin the conversation, to encourage families to talk about what it is they want at the end of their lives. It's not one conversation. It's not an easy conversation. It's many conversations over a great deal of time. And I hope both the book and the film will encourage people to have it.
Okay, we have some questions from the audience. The first one goes to Dr. Satcher. Did you learn leadership skills while caring for your wife, or did your existing leadership skills prepare you for that unexpected role?
Well, I think the answer is yes, that I learned leadership skills because I had not been in that position before. And so I think I'm better able now to support individuals and families who go through the same kind of experience that we went through. And that's so in that sense, I would say, yes, I learned leadership skills because I learned a lot about the needs of people experiencing Alzheimer's, but also how to make the best of that experience. That can be devastating.
All right, the next question is for Diane. How do you talk to people about this who are opposed to the notion for religious or cultural reasons?
Well, I think you don't talk to them, rather you listen with them. I think that engaging with people, expressing your own views, but listening very, very carefully to their views is more important than the talking you will do. I can express my own experiences. I can offer examples. But one legislator said it best. He said, you know, we are all just one bad death away from supporting medical aid in dying. Seeing that kind of suffering, seeing that kind of misery that I saw in my husband when he said, I can no longer feed myself, I can no longer stand on my own, I can no longer toilet myself. I have lost all dignity, and if I stay alive, I will go more deeply further into indignity. And I said to him, sweetheart, are you sure that this is what you want to do? Do you really want no more food, no more water, and no more medication? And he said, I am absolutely certain. And he was.
Wow. Okay, the next question. I also just want to say, like, I so appreciate how honest and real you both are. For anyone out there who's going through what I'm going through, it feels very supportive. Like honesty and truth just feels almost like a hug. And it makes people like me feel like we're not the only ones who have gone through such hardship.
I
Because
wish
sometimes you
I
do
could.
feel like it's just you.
I wish
I
I could
know.
right now, Yvonne. I really do. I wish I could hug you now. I do understand, and I feel very much as though I'd love to give you a big hug.
Thank you. I'd love to give you a hug too. And you too, Dr. Satcher. I'd love to give you a hug too. But I have a question from the audience for you. Dr. Satcher, what leaders have influenced your life and journey to improve health equity?
Well, in the book, I start off with my parents because neither of my parents finished elementary school. My mother went to the 5th grade. My father dropped out in the 1st grade. But I talk about how exemplary they were as parents in raising 9 children on a 40-acre farm. And my dad went on to become superintendent of a Sunday school. And my mom would always make sure that if we had food and the neighbors did not, that we would be going back and forth taking food to those neighbors who didn't have it. I learned a lot from them because it's not easy to raise 9 children. And I think they did a great job. And that has contributed significantly to my life and my work and my leadership roles, I think, too. So most definitely it started there. But I was fortunate also to go to Morehouse College when Benjamin Elijah Mays was president, and anybody who knows that name know that he's just a model of exemplary leadership. Spoke to the students every Tuesday morning, and there are a lot of quotes that I still use a lot from Benjamin Elijah Mays. I also came at a time when Martin Luther King Jr. was still alive. He was a graduate of Morehouse College. He spoke there at least once a year. And I went to Ebenezer Baptist Church when he was co-pastor with his father. And of course, even though I was not in Montgomery during the Montgomery bus boycott, my brother was at Alabama State College during that time, and so I experienced it through him. But again, learning through suffering in a way. A.D. King, Martin Luther King Jr.'s younger brother, taught me a lot about leadership too. He, when we were getting out of prison, 5 of us went to prison because we had succeeded in filling the jails in Atlanta. And as we were getting, and there was a young white man who sprayed us with spray when we were sitting at the counter trying to get served. So when the police came to arrest us, they had to arrest him too. And I never will forget A.D. King, when we were being let out of prison, suggested that we ask them to let this young man out also. And most of us were opposed to that. And A.D. King said something that I've always remembered. He said, nonviolence is not just about not hitting, it is about not hating. And that's what we have to exemplify in asking that this young man be let out of prison. So we did. And but it taught me a lot that it's one thing to preach it, it's another thing to actually experience it and lead in that way. So I was fortunate to learn a lot from fellow classmates. I was a pre-med student, so obviously I believe of all the people who worked in the movement, I was the only one that was a pre-med student. But I knew that I had to do well academically just as the other pre-med students. And I was fortunate enough to be able to do well. I could also say a lot about medical school, but you don't want to hear about that. Okay.
I mean, I find your life so inspiring, and I wish so many young African Americans can hear you and see how you have persevered and have succeeded. I mean, you're one of those heroes, sort of the heroes that we don't hear enough about. So thank you for everything that you have done. It's like, especially today, you know, when things are so difficult, it's so inspiring to hear from an African-American man who succeeded through such, you know, incredible history, really. So I have one question here for Diane. It's probably gonna be the last question. We have 3 minutes left. It seems important to put your wishes for end of life in writing while you are young enough that you are of sound mind. Any suggestions for ways to approach that?
You know, I did do exactly that, and Anne Morrow Lindbergh was my example. In her book about her mother, her daughter, after Anne Morrow Lindbergh died, found a note that her mother had left stating exactly what she wanted. She wanted not to be kept on any kind of machine or have her life extended beyond any reasonable hope of full recovery. And I think that that's what too many of us lose in our thinking about end-of-life issues. When the doctor says, well, we could do this or we could try this, think, is that really going to give me my life back as it was? Am I going to be fully the Diane I've always been? Or is it just going to be 3 more months of suffering, which to many people might be worth it? Some people believe that God should be the only decider. I support them 100%. Others want everything medical science can provide. I support them 100%. And I would like the option for medical aid in dying. And I hope you will support my desires as well.
Well, that's a really powerful way, I think, to end our conversation. Like I said before, this has been really an honor for me. I feel like I learned so much and that there's a lot for me to think about in moving forward within my own life. And I think that that's all anyone can hope for, is have the information, embrace it, learn from it, and then make your own decisions.
Exactly.
So thank you both.
Thank you.
Stay safe. And it was wonderful talking to you both.
Thank you so
Thank
much.
you.
Oh, and everybody out there, buy their books. They're incredible. And like I said, it's something that I think about all the time. And we need to be thinking about these things. My Quest for Health Equity, Notes on Learning While Leading, and Diane's book, When My Time Comes, Conversations about whether those who are dying should have the right to determine when life should end. Thank you both so much.
Thank you.